happen immediately. That's starting now. Each month. And what's going to happen is each month, as more seniors hit the donut hole, more and more checks will hit the mail, helping more than 4 million seniors by the end of this year. Now, beginning next year, if you fall into the coverage gap, you'll get a 50% discount on the brand name medicine that you need. 50%. And by 2020, it's being phased in, but by 2020, this law will close the donut hole completely. The donut hole will be gone. It will be gone. Now, that's not all. Beginning next year, preventive care, including annual wellness visits for Medicare beneficiaries, certain screening services like mammograms, will be free, because the best way to prevent a serious illness is to diagnose it early. This law also gives us the power to see to it that insurance companies don't raise your rates just to pad their profits. Last week, Secretary Sebelius reminded insurance companies that we've got the authority to review and reject unreasonable rate increases for Medicare Advantage plans. And she put them on notice that we will exercise that authority. Finally, because seniors are more frequently targeted by scam artists, we made sure the new law gives us stronger tools to target criminals. And I want to send a notice to all who would swindle and steal from seniors and the Medicare system. We are going to find you, we will prosecute you, and we will ultimately prevent those crimes from happening ever again. Part of the reason this is so important is because we've been receiving some outrageous reports from around the country of people trying to scam seniors out of Medicare. They'll call asking for a Medicare number or a Social Security number or a bank account information, claiming it's necessary to re-enroll in Medicare or to sign up for new Medicare cards. Some even go door to door, claiming they're selling new government policies. It's appalling and it's infuriating, and we're going to put a stop to it. And that's why today I want to announce a couple of tough new efforts to protect seniors. At my direction, Secretary Sebelius and Attorney General Holder have expanded efforts across the country to vigorously crack down on criminals who seek to take advantage of seniors and of taxpayer dollars. We've established a joint health care fraud prevention and enforcement action team, also known as HEAT. Yeah. You like that? HEAT. This task force is already focusing on certain cities with high rates of questionable Medicare expenses and charged several individuals with fraudulent billing. In addition, they'll continue a series of summits in cities across America with high rates of Medicare fraud beginning next month in Miami. At these summits, they'll work with state and local officials, healthcare providers, and others that seniors rely on most to increase awareness of fraud and share information and expertise in identifying fraud. And finally, we're going to reduce by half the amount of waste, fraud, and abuse in the Medicare system, protecting your Medicare and the American taxpayers' money. In fact, we're looking to eliminate waste everywhere we can. Earlier this morning, my budget director, Peter Orszag, laid out our new effort to cut wasteful spending across government, including asking all agencies to identify their worst performing programs as we put together the next federal budget. So that's what this law does. Now, having said that, there are some of the folks who are against health reform in Congress. They still think that none of this should have happened. They don't think you should be getting these rebates. Don't think we should be closing this donut hole. In fact, you have an entire party out there that's running on a platform of repeal. They want to roll back all these reform efforts. They say they have their own plan, but over the last 14 months of debate, they never seriously advanced it. And when you look at it, you can see why. They'd roll back the rebate to help you pay for your medicine if you fall in the donut hole. They'd roll back the free preventive care for Medicare recipients. And then away from seniors, they'd roll back all the insurance provisions that make sure that insurance companies aren't cheating folks who are paying their premiums. And their plan would let insurance companies continue to deny folks coverage when they get sick. They'd do little to make insurance more affordable. They'd gut the existing consumer protections. They'd put insurance companies back in charge. And some have even filed legislation that would end Medicare as we know it, giving every senior a voucher for health care instead. Now, I refuse to let that happen. We're not going back. We are going to move forward. That's why I was elected. So, all told, the Affordable Care Act is a law that keeps America's promise to our seniors. And it extends that promise to your children and your grandchildren and your great-grandchildren. Because in recent years, we've arrived at one of those moments where we needed to make right a long-standing wrong. Millions of middle-class Americans watched our employer-based health care system fray along the edges, leave a lot of people out. A lot of people didn't have Medicare or qualify for Medicaid. They fell into terrible situations, and we decided we were going to stand up, as we've done so many times before, to make sure that everybody got a fair shot. And we're a better nation for it. Once this reform is fully in effect, middle-class families are going to pay less for their health care. Taxpayers won't have to pay higher premiums for trips to the ER by uninsured Americans. Businesses are going to get help with their health care costs. In fact, small businesses are already learning they're eligible for tax credits to cover their workers this year. And the worst practices of the insurance company will end so that they can't deny you coverage because you got a pre-existing condition or because you happen to get sick and suddenly they decide it's not convenient to cover you. So this law looks out for future generations by doing more to bring down our long-term deficits than just about anything that we could do. And in the end, this debate was about whether we're still a nation that keeps its promises to our seniors and gives all of our citizens, not just some of them, but all of them, a chance to reach their dreams. It was about whether we're still a people that are able to meet big challenges. And I'm proud to say that the answer to each of those questions was yes. And as long as I'm president, and I've got great allies like the members of Congress who are here, then this is going to be a promise that America continues to keep. So thank you very much, everybody. And now I want to take some of your questions. Let me make sure my mic is working. Okay.
Well, as I
Secretary Sebelius is going to be like Oprah. She's going to run the show here.
But I can't give away cars, I'm afraid. So as I told you before, we have lots of people listening from around the country, and a number in here I know who want to ask questions. So we'll take the first question from the audience. Yes, ma'am. And if you would say your name and then ask your question to the president.
Good morning, Mr. President.
Good morning.
I just joined the
Can you tell us your name?
Yes, I can do that. Mary Kay Krangle, and I live in Arlington, Virginia. I just became eligible for Medicaid 4 weeks ago, and I've joined the program. My question is about...
For Medicare or Medicaid? I want to make sure. Medicare?
Medicare.
Yeah.
Did I say Medicaid?
Uh-huh.
Oh, sorry.
That's okay.
Medicare. My question is about the donut hole. I think all of us appreciate the $250, and I think that will help a lot of folks. But my concern is that it's taking so long. Why 10 years to close the hole completely?
Well, here's what's happening. Essentially, we're going to be phasing this down. And I'll be honest with you, it's just a matter of money. It's very expensive to close this donut hole. When the prescription drug plan was originally passed, frankly, we shouldn't have had a donut hole in the first place. But once that hole was created, then each year, the budget was assuming that donut hole was there. For us to close that right away would have blown a hole through the budget. So essentially what we said is, how do we provide some immediate assistance to seniors who are falling into the donut hole, and then how do we ratchet down the cost to seniors each year so that by the time we get to 2020, the donut hole's completely eliminated. In the meantime, though, as I said, I want everybody to be clear here. You will immediately benefit, first from the $250 check that you receive. Next year, we then phase in 50% discount on the prescription drugs that you're paying. And each subsequent year, what you're going to be seeing is that the costs are going to be continually reduced. Now, part of what we still have to do is we still have to work with the drug companies to reduce just the cost of prescription drugs generally. And this is something that Secretary Sebelius takes very seriously. Are there ways that, for example, we can get generics on the market quicker? Are there ways